Yeah, I did my trauma rotations at both VGH and Sunnybrook in Toronto, and quite honestly, I know we're missing. We don't have a cardiothoracic surgeon here. Like, we can't open a chest. Well, in an emergency situation, we can crack a chest open and tamponade or fix a hole in the heart briefly. But in Kelowna and Vancouver, they can. That's the only thing that we're sort of missing. That and being able to round the clock. Do you guys know about pelvic angioembolization? It's geek for if you've got bleeding vessels in the pelvis. They can put a catheter in, go in there and put some coils to stop the bleeding without opening up the patient. So those two things are the only things that we're missing. But otherwise, this place feels like a big trauma center and all that it can pull off. And it shocks me because the resources aren't there, but we make it happen anyways. The ICU is fantastic at dealing with these sick patients, and we're talking anything from 5-year-olds that have been very severely crushed by an ATV with broken pelvis and a broken femur and a head injury all at the same time. We can deal with and keep stable until transferred to the pediatric hospital, the BC Children's Hospital. From that to, I think the foundation's been well aware of this case as well, and I think she'd be okay with me speaking about her as that young girl that crashed her plane, and we received her from the critical care transport paramedic system. And, it was just a wonderful case that showcased all the things that this hospital can do. Stabilized her terrible chest injuries. We're able to, take care of her airway and have her safely breathing. Diagnosed even a ripped artery in her neck, which we screen for, which is sort of the stuff that they do in the big centers, but we do here as well. Stabilized all of her internal bleeding and packaged her up and sent her to Vancouver, and got feedback from VGH, the big house, that it was just fantastic care. So that feels good that we've got that level of care here.